Hey guys, Russell Linville. Hey, this is part of the Become a Better Human project. It is a Wednesday. That means it's a Nerd Out Wednesday. And a couple things been on my mind this week. Yesterday we talked about rehab protocols. Do they even matter? Do you follow them? If you haven't checked that video out, check it out. And so, in trying to find an answer to that, and we really know that yes, rehab protocols do matter, but why do they matter? I think it comes down to the principle of strength conditioning world of adapted stress and periodization. So I want to make sure that we're progressing patients through an acceptable strength conditioning, mobility, flexibility program while we're maintaining, if they're post-operative or if they're recently injured, while we're maintaining respect to the healing process or the surgical repair. So two articles I'm going to make available in the comments section below, or the show notes, or whatever you want to call it. I'll look up here, is by Donald Hoover, who's a PT and also a strength conditioning coach, and he's associate professor out of, I think, Western Kentucky. And his article is titled Periodization and Physical Therapy, Bridging the Gap Between Training and Rehab. And the other one is by Dan Lorenz, who is down in the Kansas City area. He's also a physical therapist and has a CSCS, so he's in strength conditioning world as well. Presents a lot at national conferences. I've had the pleasure of hearing him talk. He's got great info. And his article is a clinical commentary titled Current Concepts and Periodization of Strength Conditioning for the Sports PT. So basically the takeaway from these, and I'm not going to hash in onto these clinical commentaries too much, because I think you should read them, but it dives into what we talked about yesterday in terms of, do protocols matter? And I think what sports PTs need to try to do, and even the orthopedic PTs, is we need to try to make sure we're on a consistent and, well, let's use periodization term linear progression. There is nonlinear progression, but we won't dive too much into that. A linear progression of how do we get our athletes back onto the field. So we need to take into account not only their recent injury or surgery, but also their current mental status, right? What's their psychological status at this point? Are they motivated? Are they demotivated? Are they dealing with anxiety, depression in the past? How do we fit that into their plan? We want to make sure that we understand and know their timeline for their goals, right? Something we kind of overlook sometimes, right? We get in, we get working with them, see them in the initial eval, we get excited to work with them, and then you leave the eval and you're like, well, what are we working towards? I know he's a baseball player, but when's his first competition? When does he expect to play again? What has the doctor told him? So we need to have a timeline set in place that we have, that we can strive for. And then, it's your job as a PT or a rehab specialist, chiro, strength conditioning coach, whatever you are, to make sure that you've kind of mapped out this progression over a certain period of time, to make sure that the patient is obviously at the center of this, but you're taking into account certain milestones that they expect to hit at certain timelines. Then you can look back and determine if that's a realistic goal and try to help them reach that goal. So I really encourage you guys, if you're not a strength conditioning coach and you're a sports PT, I encourage you guys to do a little more review. In preparation for the SCS, which is the sports clinical specialist, you have to have some really baseline knowledge of periodization. But I really encourage you guys to get a certification, a post-grad, whatever certification you want to call it, in strength and conditioning. So it could be your CSCS, or one of our members on staff here, I think, has the SCCC, which is a lot of S's and C's, but it all stands for strength conditioning specialists and coaches and that sort of thing, and put you through a more rigorous instruction, I guess. And you have to sit for an exam, and sometimes you have to sit in front of a board and give your opinion on strength conditioning topics. It really pushes you to learn more about the strength conditioning world and how you can implement that into the rehab setting. And I think one of the things that we didn't get a lot of in PT school, and this may not be universal, but I think for the majority of PT schools, is there's not a lot of time spent on the sports PT strength and conditioning gap between rehab and performance. And that's an area that you can really dive a little deeper on. There's a couple books out there. Bridging the Gap, Sue Falsoni. It's a great book. There's some other ones. If you want my opinions, you can reach out to me, shoot me a message. I'll try to send you some resources. But for the most part, yes, we know yesterday rehab protocols do matter. Today, why? It's because periodization, rehab protocols are just a basic form of periodization, and we want to make sure that we're following a progression to get a patient back to their goals. So don't be a rogue cowboy out there with your PT. Don't just come up with, hey, the patient's here now. Oh, I haven't really planned and prepped for him. What am I going to do with him today? Oh, this seems pretty cool. Yes, you do need to do that sometimes, right? We progress or regress exercises. But we're not going to be, shooting from the hip, so to speak. So if you're that kind of PT, cut it out. Plan better. If you got any questions, shoot me a message. This is the Become a Better Human project. Thanks for tuning in. Subscribe if you like these videos. I'm trying to do these every day. So if you guys want to reach out, go for it. Thanks a lot for tuning in. Appreciate it.